Thank you, Faith, for that. May justice be found for that family. And as Kenya intensifies its efforts to improve maternal and child health, the reality in Kajiado South remains stark. In this sun-scorched land where drought cracks the earth and survival is a daily struggle, women walk for miles through dust, thorns and danger, seeking a safe place to give life. Mike Chalo journeyed to the plains of Oloitoktok to uncover the silent heroism of women who defy odds to bring life into the world.
In the deep south of Kajiado County, where the wild edges of Amboseli meet human resilience, lie villages like Lenkizim, Imbirikani and Risa, home to the Maasai, whose life revolves around cattle and tradition. Here the land is dry, roads broken, health facilities scarce, making critical services like giving birth a gamble.
Mingi sana yameanza imekufa kwa ajili hospitali ni mbali.
Mimi mtoto ya kwanza nilikuwa nimesalia nyumbani. Nimesalia nyumbani kwa sababu hospitali yetu iko mbali sana. Nilikuwa tunaenda huko na Melo.
The problem we have in Kajiado, we tend to do well in urban areas, but we are still lagging behind in rural Kajiado.
For over 20 years, Dorcas Musa has helped women deliver in manyatas, guided only by instinct and prayer. But after training on self-delivery, she became a force of change, urging women to seek care, attend clinics and deliver in hospitals.
Nakuja kuangalia hiyo mama, hiyo msichana ako na wasito, na kuangalia tumbo kama msuri, kama mtoto nakaa msuri, kama anatembea msuri.
Her efforts have helped reduce maternal and infant deaths by nearly 70%.
Sisi amekuja kuelewa hospitali ni msuri. Siku ile kisaa na mwaka damu nyingi ndanipotea watu.
Working with TBS with antenatal mothers, it has helped them to monitor them and to take care of them at home. Like when they are in labor, they are able to accompany them up to hospitals.
We not only bring them on board, we train them. She understands the importance of accompanying this mother to the facility for her to be able to achieve and to get the support that she needs while giving birth.
Each day she walks miles under the unforgiving sun, crossing paths with elephants, buffaloes and lions, driven by one mission: to save mothers and babies.
Sai kuja kuona msaidizi ya hospitali, imeona hiyo ya Namelo, sai kuja Dandalayan, sai imeona mzuri.
Mimi nimeona hospitali kuna msaada kabisa. Kuna msaada kwa maana unasaidiwa. Ukienda kujifungua huko hospitali, sasa mtoto akiwa na shida unasaidiwa huko hospitali.
This has become a sort of solemn ritual for Dorcas before she brought forth life into the world. She kneels beside a young woman, heavy with her second child, ensuring she's ready for a safe delivery.
Hiyo mama imekuwa mzuri. Sijapotea tena mama, sijapotea tena mtoto. Ikuja hospitali ikasaa na imepata msaidizi.
Hii watoto wangu hajapata shida kwa ajili nimesalia huko hospitali. Zamani mimi nikisalia hapa nyumbani ya mtoto ya kwanza, mimi nimepata shida.
Integrating traditional birth attendants or traditional birth companions into our system is a sure way of reducing maternal and infant mortality, and that's why we have over 200 traditional birth attendants across the area.
Kajiado ranks among the highest in Kenya for maternal and infant mortality. Most deaths are caused by distance, drought, and lack of working health facilities.
The indicators for Kajiado County are not good. They are among the top 10 counties that are not performing well.
We are all talking that even though we have a shortage of our healthcare workers, the few of them that has been employed by the county government of Kajiado, can they be available to our patients?
In Risa, a new facility built from repurposed shipping containers offers hope. It's clean, functional, and eco-friendly.
Our facility is made of containers, fabricated containers, all the way from the triage, consultation, to the laboratory.
This is a place that had nothing completely. And setting up a shipping container hospital means that it is cost effective, it is fast to build, it provides a quality healthcare for people who contribute 98% of maternal deaths in the country.
Locals call it the container hospital, a place where tradition meets innovation. Inside, postnatal wards mimic manyatas. Warm clay walls and canvas roofs comfort mothers, helping newborns acclimatize faster.
Once our mothers have successfully delivered and there are no complications, they are brought to our Manyata, our postnatal clinic, which is built to embrace the culture and help in keeping the mother warm, which by keeping the mother warm, the uterus is able to contract well and the mother is able to breastfeed well.
In order to fit with the locals and assure their comfortability, the facility has postnatal wards designed like a manyata.
We wanted women in the region to feel warm. We wanted them to associate delivery with what they're used to, their homes. Somewhere that is clean, somewhere that is warm, somewhere that feels like home.
Leah walked 15 kilometers, then rode on a motorbike for 40 more. Just 35 minutes after arriving, she delivers safely. A miracle of endurance.
I was going to Dandelion backpack outreach at Osoit, so I saw that it is good to come and deliver here due to the good services I was given at outreach. And currently, this is the first baby I've given birth at the hospital.
Since Dandelion came to RISA, there have been trainings on prevention of bleeding, postpartum hemorrhage, because initially women were bleeding so much or the placenta does not come out. So since the Dandelion has come, there is a reduction on women who are bleeding during delivery and after delivery.
For generation, childbirth among the Maasai was a private sacred affair. Women delivered in silence, guided by tradition, while the men remained distant and involved in matters of birth and care. But now a quiet revolution is unfolding. Men who once stood at the periphery now walk beside their wives. They accompany them to clinics, ask questions, and hold newborns with their trembling hands.
Pale mbeleni ilikuwa ni watu wanaona ni ngumu ama hawapendi sana kutembea na mama. Na hiyo mimi nasema ilikuwa mbaya. Mimi sasa nimekuja na bibi wangu na ni kwa sababu ya elimu. Watu wasome na tupendane pia.
The shift, which is subtle but profound, is reshaping the very fabric of family and community. Care is no longer a woman's burden alone, it's becoming a shared responsibility.
Culture, kama una masomo, unaona ni aibu kutembea na bibi wako kwa kijiji.
The more men we have who speak boldly about maternal child health, especially in pastoralist communities, the less deaths we will have because women will feel supported. And the process of maternal child health will not be a women's issue.
As a ministry, we want to bring services as closer to the people, putting in their culture and their religious beliefs.
Even as mobile clinics snake through the savannah, reaching the most isolated families, the terrain remains unforgiving. But with Amboseli's parks management now under Kajiado County, there is a renewed hope that health infrastructure will follow and that the long walk to life may one day be shortened.
Kwa miaka zilizopita tulikuwa tunapitia mashida mengi juu ya kwenda clinic. Tulikuwa tunatoka miguu from Marburg to Amboseli.
If you see, this area is a desert place. And we got more wildlife. Sometimes mtoto anakaa mpaka hatapata BCG, hatapata immunization yote.
If the government could be open enough to recognize partners who are making a change and a difference in communities such as this, and fast-track payment of SHA, then that was a way to reduce maternal mortality. Secondly, is the improvement of quality healthcare services in public hospitals. The negligence of whether it's through equipment, whether it's through service.
Amid dust, heat and danger, women walk the long road to life, proving that even in the wilderness, hope still finds a heartbeat. For many, the journey has been long and dangerous considering the environment and the proximity to the national park. But nothing is more life-saving than bringing the health services closer to them. From Oloitoktok, Kajiado County, my name is Mike Chelo.